than half of all healthcare workers are concerned about the lack of quality protective gear. You can't blame them. Nearly half didn't understand how the virus is spread or its incubation period. According to the survey by the Human Sciences Research Council and UKZN's Nelson Mandela School of Medicine, found that many have fears of passing the virus on to their families. To discuss this further, we're joined by Professor Mosa Moshabela from the University of KwaZulu-Natal. Very good morning to you. Quite disturbing findings, particularly when it comes to the understanding of the pandemic and how it's passed.
Good morning. Yes, indeed. I think that of note is that we did the survey at a time when the pandemic was already underway. The first case was on the 5th of March, but this survey was only done mid-April into May. By that time, you would expect that the healthcare workers are adequately prepared, they've got adequate knowledge, feel confident in what they're supposed to do, and arrangements have been made to make sure that their safety is ensured and the safety of their family members is ensured. But to actually then see the findings in what they reflect about our preparedness at that time, it's disheartening.
And talk us through their fear for their safety. I mean, you can understand why they're concerned about the quality of the PPE, for example.
Absolutely. And you know, the thing is, most of the time when we talk about the safety of health workers, we talk about PPE, but actually there is a lot of risk that is present in the environment itself where they work. So things to do with ventilation, for example, things to do with the different gadgets that they have to touch, pass from one health worker to the next, from health worker to patients, and things like that. Those things contain a lot of risk for healthcare workers. And even if one were to use PPE, if a mistake is made, then transmission happens. You know, we've had stories about how a lot of transmission could happen in tea rooms and so forth when they lower their guard. That's why we have to make sure that we don't just look at PPE, but we look at the environment as well. But nevertheless, I think in terms of PPE, what we found in this study was that healthcare workers in general were concerned, had very low levels of confidence in their facilities and facility managers, ensuring that there is adequate supply, accessibility, and availability of PPE in their facilities.
And you also really wonder how, excuse me jumping in here, how you can deliver to the best of your ability if you've got this niggling fear in the back of your mind, and also knowing that possibly you'd be taking it home with you.
Absolutely. And the thing is that you may have confidence in yourself as a health worker, being able to use it when it's there. But you also need to make sure that you are confident. And confidence is something that we measured across this whole study. And we found high levels of low levels of confidence across the board, but more so for nurses. They received less information, less training. They were less confident. They were not confident in the sources of information, and they were most concerned about taking COVID-19 to their households. And we know in this country that if a healthcare worker is infected or even passes, they themselves may receive compensation, but their family members may not necessarily receive any support.
And the emotional toll of this period?
It was incredible. I think that in general, we don't expect healthcare workers to suffer severe distress. In fact, no employee should have severe psychological distress because of their work. And in this case, we found that amongst nurses, it was 25%. 1 in 4 of the nurses were experiencing severe psychological distress. And amongst the doctors, it was 1 in 5, close to 20%. So this should not be. And when you combine with the fact that amongst nurses, for example, we found much higher levels of poorer health overall, and many of them were more than 60. This doubled the risk of their infection or suffering severe disease. Then, of course, this would naturally result in increased incidence of deaths amongst them as well.
Professor, what do you hope is going to be done with your findings?
So we have presented these findings to the Minister of Higher Education and Science and Technology, together with the Minister of Health and their DGs. The next day, we presented it to the National Health Council, the Minister of Health, the Deputy Minister, and all the MECs. And the day after, we presented it to the NCCCC. So yesterday, when we launched the study, we invited the different health professions council and some of the unions to participate as well. Our hope really is that a solution can be found. We've made some recommendations, but we need tangible interventions. The tone has shifted. I've started to hear the Minister of Health really talk much more seriously about ensuring that there's occupational health and safety. The facility managers have to be held accountable. I mean, we hope that we can have interventions that would shield healthcare workers. I cannot comment about all of the PPE challenges. Everybody is talking about this. But hopefully some tangible interventions can happen and we can have a follow-up study to compare if there's been improvement.
Okay, Mosa Moshabela, good to talk to you. Thank you.